This long-term care home was the first in Kelowna to vaccinate its residents. The most recent shots went into arms last month, including into 8 of the 12 people who've now tested positive for the coronavirus. It's not clear if the latest variants of concern played a role.
And this serves to remind us that while we are very confident that vaccine is very effective and prevents particularly severe illness and death, it doesn't necessarily mean that all transmission will be stopped.
Of Canada's 2,000 long-term care homes, a few dozen continue to see new infections, if not outbreaks, even though most of their residents have been vaccinated, like this Quebec home outside Ottawa, where 23 seniors still tested positive last month, but most had mild to moderate symptoms.
What we do not know, and there's still limited evidence, but it is evolving, we'll get more, is how vaccines prevent transmission. Even the most effective vaccines are not 100%.
Even so, preliminary data show vaccines are already putting the brakes on infections and deaths among Canada's elderly. In Ontario, long-term care residents saw an 89% relative reduction in the incidence of COVID-19. And in British Columbia, vaccines prevented an estimated 80% of cases in long-term care homes just 2 to 3 weeks after the first dose.
If what comes out of this is that we reduce COVID-19 from being a severe disease that takes between 1 in 4 to 1 in 3 long-term care residents' lives to being an asymptomatic or mildly symptomatic illness, that's a huge home run.
And experts say that could be the reality for the general population as vaccinations start to roll out in communities across Canada. Milder symptoms, if any at all, but no guarantee of complete immunity. Vicadopia, CBC News, Toronto.
Now, to help us understand what this all means, we're joined now by geriatrician Dr. Samir Sinha. Dr. Sinha, what do we know about whether people can spread the virus even though they've been fully vaccinated?
Yeah, so what we're learning right now is that the vaccine, while it's very effective against preventing serious illness and potentially death, is that we don't know that it's 100% effective against transmission. And that's why we know that it's actually showing that it's reducing transmission or that ability to pass that virus from one person to another, but it doesn't completely eliminate it. And that's why we're still saying that even if people are fully immunized at the moment, we still want everyone adhering to public health precautions because we know that we can still transmit the virus while enough of it's circulating around.
Right, and then how do you continue to strike the right balance? Because I'm thinking once long-term care homes have completely completed their vaccinations, should they start allowing visits from loved ones who have also been vaccinated?
Yeah, and one thing that Dr. Henry said in BC today was that, despite that we're seeing some of these outbreaks occurring across Canada and around the world, what we're seeing is very mild outbreaks that are occurring, so not significantly leading to hospitalizations or death. And so what we're hoping is that as we get pretty much most of the residents and the staff and even family caregivers vaccinated, that by the end of the month, we should hopefully have some guidance out that can start telling us how we can start doing more congregate activities like dining or group activities, and also making sure that we can start resuming visits in more of a traditional way.
Looking forward to it. And hey, Dr. Sinha, we'll be back later in the program as we resume taking your questions around Canada's vaccine rollout.